The last few years have brought challenges for patient safety to the fore and highlighted the importance of our commitment to tackle high-priority safety issues. Unsafe medication practices and the medication errors remain as a leading cause of avoidable harm around the world and costs health systems billions of dollars annually. The COVID pandemic has exacerbated the problem. Workforce shortages and fatigue, disruption to health services and supply chains, the need to self-isolate, and reduced health-seeking behaviors has led to increased rates of medication-related harm and widened existing inequalities. With these important issues in mind, I commend my colleagues at the WHO for their efforts implementing the Medication Without Harm Global Patient Safety Challenge, and in selecting the theme Medication Safety. We will have an opportunity to reflect on and discuss some of the key challenges for health systems, patients, and their carers. Research undertaken by my team during the pandemic highlights that not all patients had a negative experience managing their medication safely. We learned that patients who had their own agency, that were well supported by family and friends, and were there with resilience management systems, they often had a positive experience regarding their medication and their management. This is not new knowledge, but re-emphasizes the importance of working with patients and carers to understand their experiences and view on medications safety. As clinicians, we often focus predominantly on whether our patients are adhering to medications, but patients' main concerns are around their potential harm and side effects. If we don't understand and address these, the consequences can be far-reaching, as highlighted over the last few years with regards to vaccination and vaccine hesitancy. The patient and carer perspective is also important for us to better understand and address inequalities in medication safety. The existence of health inequalities is not new and has been exacerbated and made more evident during the COVID pandemic. We know that certain population subgroups and people living in lower and middle income countries are more likely to suffer patient safety issues, including medication-related harm. The challenge we face is trying to untangle factors that lead to health inequalities in general from factors that specifically results in inequalities in unsafe medication practices and medication errors. This will be essential for us to understand whether we focus on upstream drivers of health inequalities or develop targeted solutions to prevent harm in higher risk population subgroups. The global patient safety movement must work to address inequalities in medication safety and to support health systems to provide patient-centered, safe and respectful care for all. You will hear from our own research, including Professor Bryony Dean Franklin, our team at NIHR Imperial Patient Safety Translation Research Center, on a range of initiatives we have undertaken to generate academic evidence to address medication-related harm. We will also hear from colleagues joining us from countries around the world to share their experiences of implementing policies and interventions to tackle medication safety issues, and we are grateful to them for joining us to share their own learning. You will also hear from the Right Honourable Jeremy Hunt, who continues to champion the cause of patient safety, and we will hear his thoughts on the impact of adverse medication events and some of the efforts to combat this. I would also like to thank the Minister and our colleagues at the Department of Health and Social Care for their continual support. I hope you will all enjoy what I'm sure will be a great program of discussion, take away some of the new ideas, thinking to help in our endeavors to improve the safety of medications for all. Thank you.